It's International Nurses Day, and the day timing especially significant amid a global pandemic.
We celebrate them today, but we depend on them every day.
The World Health Organization says there is an urgent shortage of nurses worldwide, especially in low and middle income countries. The annual occasion falls on Florence Nightingale's birthday as well. Joining us now, two nurses who have battled the pandemic on the front lines. Suzanne Schnell is a registered practical nurse. She works in ambulatory care in Kingston, Ontario. And we have Kathy Baumeister, who's joining us. She's a nurse in Calgary in the intensive care unit there. Suzanne, good to see you, and good to see you as well, Kathy, joining us from across the country in Alberta. If I can start with you, Suzanne, a sense of what it's like being a nurse today amid all of this sort of crazy time we're all living with.
Absolutely, yes. Being a nurse is an amazing job. I mean, it's challenging at the best of times, but certainly right now with the pandemic, it's caused additional stresses to the job. We're needing to make sure that we take additional precautions in regards to infection control and screening in order to keep all of our patients safe.
And Kathy, what about you? You know, how it's sort of different this year as it has been in previous years.
What I have found that's the most amazing thing is we have RNs from across the region and across our hospital coming into our unit to retrain to, in case we do ever have to surge, learning kind of not being an ICU nurse, but coming and being our helpers. And the teamwork, we've always been a cohesive team, but the teamwork that we have now is amazing. There is fear. But that fear has settled now, and we are just working together. We have our dance moments for sure, but it's a very serious tone in the unit, and it's kind of depressing at times.
Suzanne, I wonder whether it's gotten any better on the front lines as well. We covered extensively the lack of personal protective equipment for nurses. What are you seeing in Kingston?
Well, certainly PPE has been a concern. It's been a concern all over Ontario. I mean, ideally, healthcare workers, we would all have PPE available to everyone, the best possible PPE that's available to deliver the safe care. On the ground, though, it's been a bit different, but I will say that in my workplace, I feel quite protected.
Kathy, what's your take on that, the personal protective equipment from your vantage point in Calgary?
My experience has been that we do have a large amount or an adequate amount of PPE. We've had some changes in manufacturers with our masks that we have to wear in the unit, and that's raised some concern with RNs. They don't have the greatest fit, but generally speaking, when we're entering the COVID room, we have enough PPE.
Suzanne, I'm curious what's been the most difficult part of this for you in the last couple of months?
I think the biggest struggle that we've had here is really the worry. I mean, we worry about us getting sick. We worry about making someone else sick, making one of our loved ones sick. You know, we're taking all the necessary precautions that we can in order to protect ourselves and our loved ones. But it is an additional stress for sure.
Yeah, the stress and the fear, and maybe I can ask Kathy as well, what you think has been the most challenging part?
I think Suzanne has hit it right on the nail. I know that before I went in to start my work in the ICU after being off of isolation, I was really actually quite scared, and I've never been scared like that in my 40 years of nursing. And just, I think the other terrifying thing is giving this to somebody we love. Even though we take precautions at work, I know that I'm following all the isolation donning and doffing. I'm terrified of bringing it home.
Yeah, well said. And I wonder as well, Suzanne, whether you're getting a sense, with your colleagues, people where you work, who feel that perhaps the worst is over, that there's not a sense of letting your guard down, but that maybe Canada has made it through the worst point.
I guess that's yet to be yet to be told. I guess right at this moment we don't know what's going to happen. This is a new virus, and I guess really we'll just have to wait it out and see.
What about you, Kathy? What's your read?
I am a bit concerned with things opening up, to be honest. I don't think we're over the worst of it. but we are prepared in case it does happen. I think this has to be taken very slowly, and this virus is nothing to laugh at. It's not the flu, it's not a cold, it's deadly.
Yeah, no, it absolutely is deadly. The other thing I'm curious about from both of you, and let me start with you, Suzanne, is all the outpouring we've seen from people around the world for nurses such as yourselves, these frontline workers, and you see people going out in the evenings and banging pots and hooping and hollering. And what goes through your mind when you hear those stories?
I think that nurses really appreciate being acknowledged. It really is so nice to see the support, the signs that are posted on outside people's homes and outside workplaces, the posts that are on social media. It's actually really nice to know that people are thinking about you and they're really out there supporting us.
Yeah, it is nice to see. It must be nice to see, Kathy.
It actually, I saw my first police firefighters, first responders drive by last Friday when I was at work, and it brought a tear to my eye. Like, it was just so wonderful to watch. My colleagues and I were standing out there and just watching all these other people who are putting themselves at risk as well, supporting us at the front lines. It was amazing.
Kathy Bouwmeester joining us from Calgary, Suzanne Schell joining us from Kingston. Both of them are nurses, and it is International Nurses Day. Thank you so much. We salute the work both of you and all of your colleagues are doing. Thank you.
Thank you so much.